Hello everyone, my name is Petronila Finai and I am from Group 4. Our topic is about HPV, Human papillomavirus, and today I'm going to elaborate more on the clinical symptoms, its environmental factors, and etc. So the clinical symptoms of HPV infection, it is a necessary precursor state to cervical cancer. Human papillomavirus cause the most common sexually transmitted infection in the world and are responsible for nearly all cases of cervical cancer. So cervical cancer is the most common cancer in women, especially women who are sexually active. A genital human papillomavirus infection can be divided into low-risk infections causing genital warts and high-risk infections causing cervical intraepithelial neoplasia and cervical and other cancers. HPV infection may be latent, subclinical, or clinical. Such disease may manifest as genital warts or as low or high-grade intraepithelial lesions. Up to 90% of persons infected with high or low-risk HPV clear the infections within about 2 years. The median time for clearance of genital warts after treatment is about 6 months, and 30% of cases of genital warts in women spontaneously regress within 4 months. And the peak of the HPV infection in women occurs in their early 20s. Its environmental factors. HPV is the most common sexually transmitted infection in women. Up to 79% of sexually active acquire genital HPV infection during their lifetime. The prevalence of genital warts, the most visible manifestation of HPV infection, is only about 1% is sexually active Americans. Genital contact is the leading risk factor for HPV acquisition, and risk increases with number of sex partners. Other risk factors include multiple partners, sex at an early age, failure to use condoms consistently, history of sexually transmitted infections. So history of sexually transmitted infections for adolescents, they can get genital warts or cervical cancer from their mother if they have it while they were pregnant, but pregnant women cannot get the vaccination for HPV because the effects that will cause the fetus if they give birth to the baby. A person can be infected with multiple types of HPV. The most common HPV type is cervical cancer. There are so many cases that present cervical cancer in women. Now, although cervical cancer is not common anymore in the United States because of the widespread screening, it still remains as the third most common cancer in women worldwide. Why do we need $100 million? Number one reason why we need $100 million to help out with HPV is the vaccination. It is the most effective if administered in childhood before sexual activity begins. This is when health professionals highly encourage the nationwide, especially parents. So now 6 in 10 are now opting to have their kids vaccinated. However, there are still millions of children and adolescents are going without and therefore will be highly at risk for the negative health effects of this virus later in life. All the kids who are 11 or 12 years old should get 2 shots of HPV vaccine 6 to 12 months apart. It is highly recommended that children from the ages 11 to 12, especially girls, they have to get the vaccine because they are the ones that are highly at risk of getting genital warts or cervical cancer. And that concludes my part for human papillomavirus.